Hi there, Dr. Keith again. I'm going to be talking to you about intranasal phototherapy, and that's what this light device here is. It's shining therapeutic laser light up my nose. I'll explain to you all the details and how good it is. First of all, let me just take it out. I will look away because it's laser light, and we'll deposit that. Don't need that from now on, but I'll explain to you why it's so valuable to be able to do it in the nasal cavities. There are particular qualities of that part of our anatomy, as you'll see. It's about blood, and it's about cleansing, changing, healing, restoring blood. We know that blood is source, okay? The blood is so good, it brings all the goodness and nutrients, it takes away waste products, it also carries messengers like cytokines and other signaling molecules, hormones of course, and our soldiers, that's the immune system. So anything that sweetens the blood, well, I know that's not a very scientific term, but I'm sure you know what I mean. It's going to improve the whole body terrain, and that's really what this device is about. A brilliant technological device that cleans and restores blood and gives it very important positive qualities, as we shall see. Now, this idea might be quite new to you. It's new to a lot of Westerners and even Western doctors, but I want to tell you the research has been going on for many decades in Russia, starting in Russia, and then latterly China's come on board. And between them they're publishing hundreds, if not thousands, of clinical papers on the benefits of this kind of light or phototherapy. Most of them are not written in English, unfortunately, but that doesn't mean the science isn't going on out there. You know, it just means we're getting left behind, basically. Originally, this was based on a kind of blood irradiation that was delivered like this by means of a cannula. You had to push this cannula into the person's vein, and then it would irradiate the blood as it went past, with all those good benefits. It's just that they later found you could do it just as easily by shining light up the nose. So it's called intranasal light therapy or phototherapy, low intensity laser therapy. Now, I've got to tell you, it's beginning to emerge that red light of a certain wavelength, 633, 635 nanometers, may be just as good. I don't quite trust the science fully yet. It's emerging, and a lot of people accept this story. What I was using and showing you just now was a laser device. That's the one I have, and the one that I use personally. But you know, it may be that the slightly cheaper devices that use only red LEDs can do as much good. The device I just showed you is one called the Violite, and you can see it's pretty lightweight, pretty portable, pretty easy to use. In fact, it couldn't be easier. You just shove the lamp up your nose and switch on, and it will do its own thing, and after 25 minutes or so will switch itself off, so you can sit reading a book, or as in my case, you can work away at the computer keyboard, and it's still doing you all that good. Okay, so I promised I'd explain why up the nose. Well, take a look at this graphic showing vasculature. If you look carefully, you'll see a person's mouth and a nose to the right there. And it's showing that there's even more vasculature to this part of the head than there is actually to the brain. It's extremely lush and well supplied with blood vessels. That means lots of blood going past. So, you know, as I said, less than half an hour, 25 minutes or so, you can irradiate all the body's blood, and, you know, several times over. Some of it will go through the nasal passages many times. It also has the advantage that it's quite near to the brain, and improvements and changes in neurological tissue are also very paramount with this. So if you shine light into the back of the nose, you can be sure some of that good is going directly to the brain. And also, you may or may not know, but you know, a nasal spray is a good way to administer drugs. Orthodox medicine accepts that. If you just spray it up the nose, it means it's everywhere in seconds. It doesn't have to then, you know, swallow it, digest the capsule. That's absorbed and it goes to the liver, maybe transformed and then taken around the body. You know, it's a slow process. If you add it to the back of the nose, it's instantly in the blood. It's almost as good as an injection, in fact. Now, there are some tremendous benefits, and I want to go through these. Originally, the research done by the Russians, they were looking at things like rhinitis and sinusitis, inflammatory conditions in this part of the face. The Chinese took this much deeper and much further and found that it had tremendous benefits for the cardiovascular system. People have had a heart attack or might be at risk of having a heart attack. The brain and nervous system, so stroke victims have benefited, as we'll see. And they've shown that the immune system responds enormously and responds very well and very positive to this kind of approach. So how does it work? Well, it reduces or eliminates reactive oxygen species, in other words, reduces oxidative stress in the tissues, all the tissues, not just the nasal passages. But we have to be careful here. We know that we want antioxidants, we want those reactive oxygen species down, but you've got to have some. And in fact, we need a low level. It's called redox signaling. And if that signaling process isn't there, in other words, the presence of a little reactive oxygen species, then the body doesn't do what it should do, which is release superoxide dismutase. That's one of our most powerful antioxidants. There are others too. So we need to trigger a sort of low level of activity in order that we get the heavy guns and the cavalry on the case. It also has been quite clearly measured to have benefits on the metabolic pathways, especially energy processing, where we make ATP, we add electrons, and then off goes the ATP, and it surrenders those in the tissues, releasing vast amounts of energy as it does so. Well, it's been shown to increase ATP production by as much as 150%. That's half as much again, which is pretty dramatic. And of course there's a lot of Chinese work on this, as I said, so they're talking about things like maybe improving qi or improving the flow through acupuncture meridians. If you like that model, you'll probably be glad to follow that line of thought too. It also boosts a very important ratio, the NAD plus and NADH ratio. That's particularly important. It's got to do with a whole raft of enzymes and detox enzymes, processing enzymes, that really add up to basically longer survival, longevity. And also releases higher levels of circulating sirtuins. These are important compounds in things like resveratrol, I'm sure you've heard of that, and its health benefits. I mean, there's debate, you'd have to take quite a lot of resveratrol, but there's no question that sirtuins do have beneficial properties, and these are also released by the technology I was just describing to you. All right, let's look then at cardiovascular benefits. Let's do that first. It certainly improves the lipid profile, or blood fats, if you want to keep it simple. It lowers the dangerous triglycerides by nearly 10%. That can't be bad. Lowers cholesterol by 15%. Now, cholesterol's contentious. We need some cholesterol. There's no point in just lowering it across the board. But there's good and bad fractions of the cholesterol. And basically what happens with this technology, it increases the HDL. Part of that is certainly recognized as good cholesterol, up to 12% more of that, and lowers LDL. Again, it's not all bad, but parts of the LDL fraction are felt to be dangerous. Those are lowered by nearly 10% too, 9.2%. So, very significant improvements in blood fat profile, in other words. There are also considerable improvements in blood circulation parameters, and I'll come to why in just a moment. But it will lower blood pressure, for example. It increases coronary blood flow. Now that can't be bad, especially for people who've had a heart attack already, or those that might be imminently in danger of one. It's good to have plenty of oxygen and nutrients to the heart muscle. I don't need to elaborate on the importance of that to you. It also increases cerebral blood flow. That's good for us all, especially those of us who are looking at aging or later years. The more blood flow we can keep going, the better we are mentally and our cognitive functions. And of course, if you've already had a stroke, that's good too. It increases repair, speeds up recovery, and minimizes the damage. How does it do all this? Well, it does it with a very important aspect. It is able to reduce blood viscosity. Now, by viscosity, I mean the kind of stickiness or sludginess. Take a look at these two pictures. The picture that you see on the left is blood that's coagulated. Well, it's not coagulated, that would be the wrong word, but it's kind of sticky, sludgy. And you can see the red blood cells are all strung together in little rolls. They're called rouleaux. And they're kind of stuck together. They will certainly increase blood viscosity and make it very difficult for blood to flow through small blood vessels. At the very least, it'll slow it up, which means less nutrients and less oxygen. But look at the picture on the right. That's after 25 minutes of treatment with something like the Vilite that I just showed you. And you can see it's broken up all those stringy rouleaux, or all those sludgy strings that are formed in the blood. It just releases them. All the cells are separate. The red cells are separate one from another. They can move their own way, and they're also not crowding out the white cells, so the immune cells can get there and function too. Tremendously improved. I can't overstate how much improvement there is over these two pictures. Listen, it's emerged today that blood viscosity is probably the number one thing that doctors should be measuring to see if you're at risk of a heart attack. That's more important than even C-reactive protein and fibrinogen and these things, homocysteine. They're all kind of clues. But the bottom line is, the slower the blood is flowing and the stickier it is, the more likely it's going to clot. And a clot in the wrong place, as you know, is a disaster. In the brain, we call it a stroke. And a clot in the heart, we call a heart attack, a myocardial infarction, or a coronary is the sort of slang phrase. Now, because of these improved blood flow, nutrient, oxygen parameters, there are great benefits all over the body. I picked up this study because it focuses on an area of the body that's notorious for poor blood flow, and that's the lower legs. It really is quite a job getting a healing process going down there, because blood supply is naturally so insufficient and weak anyway. But look, this study from Hungary, Budapest University in Hungary, Semmelweis was originally, he's the man that talked about, washing your hands to avoid transferring sepsis. A whole story in itself. But anyway, it's named after him. And this study was using this intranasal low-level laser light, low-intensity laser light therapy, and had tremendous benefits. The healing process was dramatically improved. It affects us in sleep. Now, sleep is very important to us all, and this kind of intranasal phototherapy, as I've called it for short, is very good at releasing melatonin. You probably know melatonin as the sleep hormone. We need plenty of it to get to sleep. Obviously, you need to do things like rest and relax before sleep, have a darkened room, silence. You don't want to be outside a busy factory or a busy street right outside the window. But all those factors taken into account, then the last thing that you need is melatonin, and that will finally put you to sleep. It's a very important part of the process. And actually, it's been what's called a polysomnogram. That's the way of measuring sleep levels. Like sleep stages, 1, 2, 3, and so on, REM sleep, you probably know all these terms. Don't need to get very technical about that. Let's just say it improves all the signs and the results of a person going to sleep. And after as little as 2 weeks, and certainly between 2 and 4 weeks, 80% of people show dramatic improvement in their sleep habits. I repeat that sleep is one of the most significant markers of all for health. If you're sleeping badly, you are sick. Bad sleep is a sickness. It's a disease in itself, but the repercussions are quite serious. It leads to inflammation, obesity, psychological deterioration, all sorts of things go wrong. So sleep is pretty crucial. Okay, now I mentioned cerebral blood flow, increased blood supply to the brain, more oxygen, more nutrients. It's only logical that it's going to help us stay fitter mentally longer, avoid things like dementia, stall the onset of Alzheimer's, or slow it down if it's already arrived. And using a device like this has been shown to improve memory test scores quite significantly. And also reducing the amount of beta amyloid. You probably know that's that sticky plaque stuff that we think is, I don't think it's the cause, but it's certainly present with Alzheimer's disease, and reduces it by 20%. But look, here's a hot tip. If you combine it with green tea extract, you can reduce plaque by as much as 60%. So get one of these devices and order yourself some packets of green tea, and you're good to go well into the 90s and possibly beyond the age of 100. Now, if it's good for Alzheimer's, good for the brain, logically it's going to be good for Parkinson's disease. That's another aging degenerative process. And sure enough, that you measure this thing called serum 3-cholecystokinin octopeptide. Now that's a bit of a mouthful. Even I had to look at the slide. But don't worry about it. It's just a marker for cognitive decline. The more of that there is, the more the person's in trouble and the more they're aging and getting senile. So decreasing it to normal, wow, that's pretty miraculous actually. Well, extremely, it won't be a miracle because we know how it happens. But you know what I mean? It's extremely valuable to a person and the person's health. And therefore, not surprisingly, test scores of all kinds are going to improve. Very good for the brain, in other words. Another study from China, this is a 2003 study I found they were looking at 36 Parkinson's patients, again using low-level intranasal light therapy, just 30 minutes a day over 10 days, produced significant change. 31 of the patients, that's 89%, showed really quite significant improvement, and nearly a third of them showed some very dramatic levels of improvement. So don't underestimate it, just shining a light up your schnoz for less than 30 minutes or just under that for even just as much as a couple of weeks can produce tremendously beneficial changes. And of course, like a lot of things, if you keep going, then the benefits mount. So after months of using these things, there's very definitely significant improvement. Not surprisingly then, it's good for stroke cases, and there are various tests, the Fugi-Meyer testing, movement and recovery test, and the Bartel index scores. These are ways of measuring how well a person's doing, how much damage, and how fast they're recovering after a stroke. These are tremendously beneficially impacted by simple devices like intranasal light therapy. So all round, very good stuff. Now, it's also tremendously analgesic, okay? It works really well with things like chronic headache, migraines, and that terrible sort of half-sided headache with severe stabbing pains that's called trigeminal neuralgia. Why should that be? Well, this laser light therapy releases endorphins. Beta endorphin is very powerful. In fact, it's said to be more powerful than morphine. The point is it's natural and it belongs there. It's an on-board morphine or analgesic compound like that, and certainly works. And there's tremendous benefits. 90% of cases had improved levels of this beta endorphin, and therefore correspondingly less levels of pain suffering. Good for wound healing too, even. And of course that's just another aspect of pain and another way of looking at things. What about cancer? You might ask that. Well, yes, you've got to be wary what we say here. It does seem, I think overall you can say it's better for prevention or recovery from treatment than it is actually as a direct cancer treatment. I think that would probably be irresponsible. But there are 3 stages in which this can be valuable and helpful. First of all in prevention, then in getting rid of the cancer-related pain, especially to do with the therapies. So, radiation therapy, for example, burns, and it's very unpleasant. And then the post-treatment recovery phase, if a person's been through chemo, surgery or radiotherapy, then it's great for the recovery and rehabilitation process. So it does have value. Why should it be good preventative? Well, I've told you it does real good to the immune system. And intelligent people these days would consider cancer probably as mainly a disease of the immune system. The cancer cells are there anyway. But a good immune system will knock them off quite quickly before they get a chance to cause any trouble. Using low intensity laser light therapy, you can dramatically boost the level of T cells. Those are the ones that release antibodies. So it's going to be beneficial for certain kinds of tumor, especially the viral borne tumors, things like Burkitt's lymphoma, hepatitis B conditions, papillomavirus causing cervical cancer. These are, and Helicobacter is a bacterial form which is notoriously associated with stomach cancer. So logically these are going to be benefited then. As I said, if a person's got cancer, they've got pain and bone pain, and especially if they're having chemo, they get really exhausted. The cancer-related fatigue can reach quite alarming proportions, where the person has difficulty almost lifting their head. This is great, and this does help, partly by relieving pain and partly by rejuvenating in the ways I've said, with improved nutrition and blood flow. And then lastly, as I said, it does have value in recovery after the treatment. Not everyone these days would believe in or opt for conventional therapy. People are very mistrustful of it. But for those that do, well, listen, even if you don't, let's face it, Gerson therapy and some of the enzyme detox therapies, they're pretty vigorous and pretty heroic anyway. They're pretty exhausting. So anything that can get you more ATP and more energy, anything that can reduce pain levels, energize you and get all that blood flow, nice blood flow going to the brain so that you're firing on all 4 cylinders, all that's got to be good, right? So it's tremendously beneficial in a wide range of conditions. And this is my choice. It's the one I own personally. As I said, it's called the Vielite. Vielite Prime is the one that does laser light. There's a slightly cheaper version. It only does red light. It's not the same penetrating degree of laser light. And it's only, well, it's just under $400. So I think that's a pretty good price. When you factor that down over the space of a few years, take it by the end of 10 years, what's $40 a year? It's less than $1 a week. So they're really very good. They're very robust and will last a long while. And if you want to get one, you can go and order one on my website. Sometimes we have good offers. You can save money. I don't guarantee the offers are there all the time. But if you go to alternative-doctor.com/nose laser, then you'll find a purchase pathway from there. Okay, well, I hope you found this interesting, one way or the other. I hope you get into this. As you see, I've got mine. I use mine frequently. And, I'm hanging on to my years pretty well. 70 next birthday. You wouldn't say I thought or behaved much over a 30-year-old and still feel and look mostly like I did in my 50s or late 50s. Not all to do with this, some of it's to do with all the other health things I do, particularly avoiding toxic foods and so on. But there's no question that this is a valuable adjunct to the health program. I can feel the benefits from it anyway. All right, thanks for listening. Take care.